My name is Lori Cummings, and I'm a student at Rocky Mountain University of the Health Professions. I'm studying nurse practitioner, doctor of nursing practice program, and this presentation is on Watson's theory of transpersonal caring. I chose this theory, Watson's theory of caring, because it is a multidisciplinary view of nursing care as the art, science, and spiritual practice it is meant to be, because it reflects the highest ethical ideal from a form of compassionate service to society and humanity. Why should we study this theory? Watson writes, nursing's timeless, ancient, enduring, and most noble contributions come of age through a caring science orientation, scientifically, aesthetically, and ethically. The caring moment occurs when one's consciousness, intentionality, energetic, heart-centered presence is radiating a field beyond the two people or situation, affecting the larger field. Transpersonal caring seeks to connect with and embrace the spirit or soul of the other through the process of caring and healing and being in authentic relation in the moment. Theory, content, and appropriateness. The study of nursing theories like Watson's theory of transpersonal caring is supported by the American Association of Colleges of Nursing's Essential Doctoral Education for Advanced Nursing Practice, specifically Essential 3, which supports clinical scholarship and analytical methods for evidence-based practice. Essential 3, clinical scholarship and analytical methods for evidence-based practice, is particularly fitting as scholars give meaning to isolated facts and makes connections across disciplines and through the scholarship of integration. The scholarship of integration concerns itself with how can we frame the new knowledge that we are acquiring within a context of a nursing theory and translate this into everyday practice. Some questions that the nurse can ask him or herself are, how do I make a difference in people's life and suffering? How can I be informed by the clinical caritas process in my practice? And how can I be inspired by Watson's caring theory in my practice? The nurse-patient relationship of caring under this theory can be potentiated to include the policy-making nurse-patient population care model as nurse leaders rise to the roles of policymakers. This can be done using Watson's Caritas process. This is a 10-step process which we will expand on in the next slide. Ways to consider each step of the 10-step, 10 curative factors or Caritas processes. With step 1, we might want to reflect on how my respect for the patient and others allows me to be available to him or her. Looking at factor 2, we might wonder or ask ourselves, by listening, was I able to honor this patient's belief system and enable him or her to feel their own sense of faith and hope? With factor 3, you might ask yourself, by being more responsive to the patient's needs and feelings, was I able to create a more trusting, helping, caring relationship? Fourth, do I develop helping, trusting, caring relationships with patients, families, and members of the healthcare team? Expanding upon factor 5, we might reflect and wonder, do I co-create caring relationships in caring environments to promote spiritual growth? Sixth, do I exercise other-centered problem solving and scholarship in caring for the patient? 7, this co-created caring relationship, is it promoting knowledge, growth, empowerment, and healing processes and possibilities for patients and for self? Considering factor 8 of the Caritas process, the question one would want to ask oneself is, have I, by promoting the caring relationship, created space for this patient to generate his or her own wholeness and healing? 9, was I able to meet the needs of this patient identified by him or herself? And 10, I allow for miracles to take place with self and others. Am I open to that kind of a thought process? Some may criticize Watson's theory of caring because it can seem out there, very abstract. It encompasses a lot of disciplines. It's quite philosophical, even metaphysical, and many people aren't comfortable with going out there that far to frame a theory of caring as Watson does. Nevertheless, when you try to understand what the patient is experiencing, what the patient's health goals are, how the patient fits into their social, familial, and cultural contexts, then when you reflect on yourself as a nurse meeting the patient's needs where they are, you are essentially doing Watson's Caritas process. So although it has sources that are philosophical and metaphysical in nature, the Watson theory of caring is really quite practical. And when you express caring as a nurse, it is really a pretty down-to-earth process. And this concludes my discussion of Watson's theory of caring.